And we're back with breaking news, 7 degrees north. Please turn on your subscription notification and follow and share. The days of full COVID coverage are over. Insurers are restoring deductibles and copays, leaving patients with big bills. Jamie Azar left a rehab hospital in Tennessee this week with the help of a walker after spending the entire month of August in the ICU and on a ventilator. She had received a shot of the Johnson & Johnson vaccine in mid-July, but tested positive for the coronavirus within 11 days and nearly died. Now Azar, who earns $36,000 a year as the director of a preschool at a Baptist church in Georgia, is facing thousands of dollars in medical expenses that she can't afford. I'm very thankful to be home. I am still weak, and I'm just waiting for the bills to come. I don't know what to do with them, she said Wednesday. In 2020, as the pandemic took hold, U.S. health insurance companies declared they would cover 100% of the costs. But this year, most insurers have reinstated copays and deductibles for COVID patients, in many cases, even before vaccines became readily available. The companies imposed the costs as industry profits remained strong or grew in 2020, with insurers paying out less to cover elective procedures that hospitals suspended during the crises. Now, the financial burden of COVID is falling unevenly on patients across the country, varying widely by healthcare plan and geography, according to a survey of the two largest health plans in every state by the nonprofit and nonpartisan Kaiser Family Foundation. If you're fortunate enough to live in Vermont or New Mexico, for instance, state mandates require insurance companies to cover 100% of treatment. But most Americans with COVID are now exposed to the uncertainty, confusion, and expense of business as usual, medical billing and insurance practices, joining those with cancer, diabetes, and other serious costly illnesses. Insurers continue to waive costs associated with vaccinations and testing, a pandemic benefit the federal government requires. A widow with no children, Azar, 57, is part of the unlucky majority. Her experience is a sign of what to expect if COVID, as most scientists fear, becomes endemic, a permanent, regular health threat. The carrier for her employee health insurance, United Healthcare, reinstated patient cost sharing January 31st. That means because she got sick months later, she could be on the hook for $5,500 in deductibles, copays, and out-of-network charges this year for her care in a Georgia hospital near her home, including her ICU stay, according to estimates by her family. They anticipate she could face another $5,500 in uncovered expenses next year as her recovery continues. Bills related to her stay at the out-of-network rehab hospital in Tennessee could climb as high as $10,000 more, her relatives have estimated, but they acknowledged they were uncertain this month what exactly to expect, even after asking United Healthcare and the providers. We still don't know where the numbers will land because the system makes the family wait for the bills, said Azar's sister, Rebecca Straub. United Healthcare declined to comment specifically about Azar's situation unless she signed a blanket waiver allowing release of all her health records, which she declined. In general, a person with Azar's type of plan would have an in-network deductible of $1,500 and an in-network out-of-pocket maximum of $4,000, said United Healthcare spokeswoman Tracy Lempner in an email. Lempner declined to say what a patient's out-of-network, out-of-state share would be at the Tennessee Rehab Hospital. She did not respond directly to a question about why United Healthcare chose January 31st to stop waiving deductibles and copay for COVID treatments. The cost share waivers were just one piece of our overall response to the COVID-19 pandemic, Lempner said. We have focused our efforts around helping our members get access to COVID-19 related tests, vaccines, and treatments, while providing additional support to our clients, care providers, and local communities. United Health Group, United Healthcare's parent company, reported $15.4 billion in profits in 2020, up from $13.8 billion in 2019. The charges, as our anticipates, would be budget crushers, Straub said. Her relatives are seeking help from the public on a nonprofit patient fundraising website called Help Hope Live, which says it verifies the circumstances of each patient's condition with medical providers. In a Facebook call from her hospital bed in Chattanooga last week, Azar cited prayer from family and friends for helping her maintain a positive attitude. Although she considers the change in insurance practices unjust for people who get sick this year, she said she harbors no personal animosity toward United Healthcare. I got here a year late, she quipped. Even though it may not seem fair or seem right, it's just where we are. She said her doctors surmised she might have already been exposed to the coronavirus when she received her Johnson & Johnson shot in July. The lack of uniformity in COVID insurance practice across the country this year is striking. In some places, because of differences in health plan policies, COVID patients in the same hospitals and in the same ICU units could be facing completely different financial burdens.